Good morning. I want to start by thanking Sfuku and John and Absentia and Andy for organizing and for having me. Thank you very much. I'm excited to be here. For those of you I haven't spoken with, my name is Clay. I'm from the University of Tennessee, and this is a paper that I've co-authored with my advisor, Taylor Schauer, that looks at how import competition affects worker health. So this graph shows Chinese exports to the United States. As we know, this exploded in the late 90s and in the 2000s, spurred in part by their accession to the WTO in 2001. So we paid a lot of attention to how import shocks like this affect various dimensions of firm behavior and labor market outcomes. We know that firms in the market are more likely to shut down, their growth rates slow, and entry in competing industries goes down. We know that firms that do survive find ways to become more productive with their backs against the wall for all these postulated reasons in the literature. And in this paper, we're going to ask what those responses effects are on worker safety in the firm. So first, I want to convince you that this matters. So in 2011, about 3.5% of U.S. workers were hurt on the job or suffered a job-related illness. That incidence is down about 65% since 1970, but the fall in the incidence has been offset by a rise in the average cost, where as a share of firms' costs, these have been pretty constant and they're quite significant. So in 2007, there were a total of about 9 million occupational injuries and illnesses in the U.S., that 60,000 which resulted in death. And those cost about $250 billion in welfare losses to firms, to workers, and into taxpayers through tax picked up by the government. And so my takeaway from this is that it's an important consideration for firm behavior because it is such a significant contributor to their costs. So I'm going to motivate this paper with the separate literatures from the occupational safety and health and from trade to explain why we think these might be linked. So the OSH literature says that worker injury rates depend on the technology of the firm. It depends on the firm investments. It depends on the relative priority that is given safety aside other competing objectives like output. And it depends in part on worker behavior and their job security, their outside options in the labor market. And we know from the trade literature that import competition affects pretty much all of these things. It affects firms' technology decisions, it affects the labor markets, and it affects firm investment decisions, among other things. So the intersection of the two suggests through consequences for worker behavior and for product and labor markets, import competition might affect worker health outcomes. So that motivates our question, exactly how does it affect worker health? So I'm going to show you a theory that we developed. It's a partial equilibrium model that explains how import shocks affect worker health in the short run, show that firms can increase their output at the expense of their workers' health. And it captures exactly what their short-run effects are. And the prediction that we'll take from the model is that import competition hurts workers, especially the least productive firms. The data we're going to test this with is from OSHA, the Occupational Safety and Health Administration, the main regulatory body in the U.S., and its establishment-level injury and illness data. And I'm going to take that data and match it with two existing measures of import competition, one from Otter Dorn and Hansen, and the other from Pearson Schott, and look at exactly how changes in import competition affected those health outcomes. To preview the results, we find that import competition does increase injury rates, and the effects are greatest at the smaller and theoretically least productive plants. The average effect across all industries, across all plants, is about an 8% increase in injuries, relative to counterfactual of no supply-driven growth in Chinese imports. So we married these estimates with estimates on the cost to worker welfare from the value of statistical life, and find that the cost of worker welfare is equivalent to between a 0.5% and a 1.5% reduction in wages. So to put that in context, right, Arkolakis and Rodriguez-Cuellar recently discussed gains from eliminating tariffs of about 1.7%. So these are potentially on par with what we're seeing in wages, at least in the short interval that we're going to be looking at. Yeah.
So you said in the theory, firms achieve more output by sacrificing worker health.
That's right.
But with more import competition, they are actually forced to reduce output because they can't arguably compete at the old marginal cost.
Right.
Maintain the market share. So output will actually shrink. Should that mean in the theory that worker health goes up?
No, so I'll show you the channel here in a second, but it's output per worker. And I'm kind of going to tiptoe a little bit, right, because it's the productivity of labor, but I don't want to use the term productivity because I want to distinguish that from fee, right? So it's not, firms will still have exogenous productivity, but as I'll show you, the marginal product of workers depends on fee and also on the effort that they extract from their workers.
And so it's the trade-off is they reduce marginal costs to keep competing in tougher markets, and then sacrifices.
The channel that, it's going to come through a resource channel. If you'll give me just 1 second, I'll show you, and if it's still unclear, please let me know. And there's certainly other stories that we can talk about that as well. So in aggregate, the back of the envelope exercise attributes between 75 and 90,000 injuries among U.S. manufacturing workers per year to the growth in Chinese import competition and the total cost of worker welfare somewhere between $2 and $9 billion. And I'll run a bunch of robustness checks to address some of the identification issues that are coming from this. So the trade literature has obviously paid a lot of attention to these labor market effects, generally focusing on long-run wage effects. One particular subset of that literature I want to draw attention to is models which have incorporated labor market frictions. So models with search frictions or shirking wages, or maybe most intuitive and understand fair wages, they explain that workers don't all make the same wages, right? So in a fair wage story, the firm is sharing some of its rents with workers, and if they don't, the workers won't exert effort for the firm, and so workers at more profitable firms earn higher wages. And the reason I point this out is, in the long run, and the reason I point this out is we can think about the implications for worker safety if instead of, say, sharing rents with workers in the form of wages, firms are sharing rents in the way of safer working conditions. So one way to think about this within the literature is that, and the long-run prediction there from those set of models from Levine and Davis and Egger and Krakermeyer is that safety improves at the most productive firms, those firms where profit rises, but it worsens at the less productive firms, those firms where profits go down. It's going to move in the same direction. And the net effect in the long run would be ambiguous and depend on exactly what the nature of the shock was, based on evidence that the wage effects of these unilateral shocks depend on the markets. So it's not clear, based on the theory, exactly which direction these might go in the long run. Our model is going to explain these short-run effects, and that's what we're going to test in the data.
Is there business cycle evidence that there are more on-the-job injuries during a recession?
It goes both ways. So the evidence is a little bit mixed. Originally, people found that there was a pro-cyclical relationship between business work-related injuries in the business cycle. So injuries go up during expansions. But the story there, that a follow-up paper by Jan Boone and Jan Van Ouwersen in JAG says that actually it's from underreporting. And I'll address that with our data. The story there being that during a recession, I'm more fearful of losing my job, and so I'm less likely to report injuries. And so even if there's no change in actual injuries, that shows up as, as a fall in injuries during a recession. So it's not immediately clear which direction it might go. And that might be a concern for our data as well, the reporting issue, which I'll address with our message data. So our paper is most closely related to the recent paper by Otter Norden Hansen in the ADR and paper by Pearson Schott, their MER working paper, and then we're going to be looking at the labor market effects of Chinese import competition, whereas they look at wages, employment, and more conventional outcomes. We're going to be taking those instruments to look at occupational safety. And recent work that Jakob has with Dave Hummels and with Chung that looks at job-related injury and illness effects of Danish export growth. So I think, as best I understand it, that they're looking at the other side of the coin and looking at how export opportunities affect work-related illnesses. And they find actually that there's an increase in total injuries with exports. And briefly, it doesn't necessarily go against reason that we might see injuries go up with exports and with imports, right? In the same way that you might be stressed and pushed at work, whether you're pushing overtime and working 50 or 60 hours a week, or whether you're facing shorter work schedule and you're facing 20 hours a week, right? Both are kind of shocks that are deviations from the norm, and so our channel is going to be different from theirs. But we find that with imports, injury rates are going up.
So this is why I asked the question.
Yeah.
It seems like you do have to take a stand. It's like, does everything increase injuries? Like, what would reduce it?
So I guess I would pose it.
You don't want to step on Jakob.
No, I don't, especially because he's my spouse at the moment. But let me pose it to you this way. If you're someone who works 40 hours a week consistently, and your boss pushes you and you come in the next week and you work 60 hours, there's going to be some stress there. If you come in the next week and your boss says, we don't really need you this week, we don't have as much demand, you're only going to work 20 hours, there's going to be some stress associated with that too. They might be different channels, but in the sense that if you're pushing people harder, you can see more stress, or if you're seeing it in a different direction.
Okay. So if you had effort, then as soon as I don't have to exert effort, then something like that.
Yeah. That's the way I reconcile it. It's the best answer I have.
This literature has to sort of, you can't be that everything kills us.
Yeah, so I'll put my hands in the air and say that we have a long way to go with this literature, right? There's precisely 2 papers, to my knowledge, that have ever worked on this, and they've both evolved in this past year. One looking at exports, one looking at imports. So obviously it's still young. I think there's a way to go in terms of identifying that here. But at least for now, our results say it worsens, and as I understand it, the results say it also worsens. Maybe I'm going to speak for that one. He's up here. Okay, so the contributions of the paper, our theory connects import shocks to a non-wage part of compensation for workers, and we're going to study the short-run effects of those trade shocks. As opposed to long-run models of trade, we're going to focus on the behavior of firms in the short run, which is going to include those loser firms that are pushed out in the long run by import shocks. Those that are arguably most affected, but those effects won't show up in a long-run steady-state wage comparison, right? Using this novel data set, we're going to provide the first evidence that import competition affects workplace safety, and that these welfare effects are substantial, and that we should consider them when looking at trade policy, and that regulators should also consider the fact that import competition is an important determinant of worker injuries. So, onto the model. Firms have some exogenous productivity drop fee and produce output as a function of the total worker effort that they get. So, if there's constant returns to scale in the total amount of worker effort, workers are lazy, they would rather not exert effort, and so the firm has to invest some resources in order to increase the effort of the workers. So I'm going to draw from the efficiency wage literature here and assume that firms have to monitor worker output some, or motivate worker output, and the more resources they invest in that, the greater the effort of the worker. So you can think about this as I'm working in my office, all else equal, I would rather not be working so hard. Gayor comes by my office more frequently and continues to check on me, I'm going to work harder because he's exerting some resources to try and motivate me. In various forms. The other piece of this is that workers can be injured as a part of their job at the firm, and that those injuries, when they do occur, are modeled as costs to the firms. And this is consistent with the fact that U.S. firms paid some $55 billion in direct costs of injuries in 2011 in medical payments and in workers' compensation. And even greater than that are the indirect costs that firms have to pay. So if workers are hurt, firms with experience-rated workers' compensation insurance have to pay higher insurance premiums in the future years. Those firms suffer productivity losses due to hiring, due to stop demand and hiring inferior workers, demand penalties from ill will. It doesn't look good to have your workers be hurt, personnel costs to hire and train workers, and so forth. So all these indirect costs that the firm can incur for a number of periods going forward, provided that it operates. So I'm going to assume that the firm is judgment-proof. So there are these future costs for injuries today, but those only matter if the firm is still operating in the future. So it could come through with these direct costs because there's some legal constraint like the corporate bail that's going to protect the decision makers from liability for those, or it could come through implicitly with these indirect costs, right? So if I have a worker who's hurt today, I have to pay more insurance costs tomorrow, but that's inconsequential if I'm not operating tomorrow, right? So those realized costs only matter if the firm operates. And this is kind of the crux of the model. And the firm faces some exogenous risk of shutting down in each period, delta, and that's how I'm going to introduce import competition into the model. So with this, if there's an increase in the probability of the firm shutting down, the expected cost of worker injuries goes down. It's less likely I'm around tomorrow. I'm not so concerned about hurting my workers as I otherwise would be because it's less likely I'm around to foot the bill. So specifically, I'm going to assume that the injuries cost the firm C when they occur, and they decay at an exponential rate over time. The managers don't have to take these injuries laying down, but they can expend some share of their resources on improving safety of the firm, such that the injury rate for workers is decreasing in their investments in improving safety, but the firm is constrained in its resources. There's some limited amount of resources it can allocate across improving output and worker effort versus investing in improving safety and reducing injuries. So the firm faces some trade-off between the two. This is consistent with, say, a manager at the plant having a finite amount of time and choosing how to allocate that across increasing output versus checking on worker safety compliance, training workers on safety, and those two competing objectives. Or the occupational safety and health literature would say workers have some limited cognitive load that they can allocate across increasing output versus being safe. And how workers choose to allocate their attention across those two depends on the safety culture of the firm. Right? If the firm hangs a big sign up that says no accidents in 108 days, workers are more likely to be cognizant of their safety, but that's going to come at the expense of their productivity. More firms could also be financially constrained. Right? So because of this trade-off in resources, increasing effort and increasing output at the firm comes at the expense of lower safety and greater worker injuries. This is kind of the trade-off that the firm faces. Firms have CES demand to maximize their expected lifetime profits. I'm going to make two big assumptions on this slide. The first is that delta is exogenous, so the shutdown rate of the firm is exogenous, does not depend on its choices today. Its choices today only affect the future profits then through the injury costs in the future. So the total cost over the lifetime of the firm of an injury that occurs today is then given by this stream of expected values, which comes down to this term over here on the right. So an injury today, an expectation over the total lifetime of the firm, the cost of that is going to be decreasing in the probability of the firm shutting down, as well as the firm's discount rate. Firms maximize their expected lifetime profits. So in terms of today's choices only, that's going to depend on today's revenues as a result of its choice of resource allocation and labor, the wage payments, and also the injury costs. So this is a Bellman. I'm just chopping off future revenues for the sake of showing it because they don't depend on the choices of M and L today. The second big assumption,
Sorry, just to go back to your motivation. You're not going to consider technological potential to change technology that might actually affect health?
In the theory, no. In the empirics, yes.
Okay.
So I'm going to be relatively ambivalent about empirically about what the channel of these adjustments are, as long as they're endogenous to trade shocks. So if it's the case that firms are not either upgrading their technology, moving in one direction, or potentially letting it deteriorate, that's going to come through in the empirics. It's just not the channel that I want to highlight here.
Okay, but if you were to introduce it in the model, make it a bit richer.
Yeah, so if I were to introduce it in the model, it would, I think it would need to be the case, right, that the firm, there's no $5 bills laying on the ground, right? So if a firm is already going to be buying up whatever technology is going to both improve output and improve safety, right? So if I'm looking at a firm potentially moving beyond that optimum, there being some benefits, I suppose the easiest way I would think about it here is that if a firm can invest in something today that's going to yield benefits going forward, say either some new productivity technology or something related to safety, that's going to yield benefits going forward, and those benefits are only going to be realized contingent on the firm operating in those future periods, you would get the same sort of effect. So I'm looking at this from a cost side. It could be I'm not going to train all of my workers and spend an entire day training them for safety because I don't expect to see the benefits of that a year down the road. Or the comparable story specific technology, sure.
So import competition doesn't come in per se, you just change the delta, is that what?
Yeah, import competition is just coming through in the delta here.
Well, but that's only the extensive margin. At the intensive margin, these firms also capture smaller market shares, have lower rents. So, if I'm not mistaken, in this version of the situation model, they actually have lower incentives to monitor. And therefore would spend more on safety. So you have actually, if you really consider the intensive margin, you would have two opposing effects. Which somewhat goes back, from the other perspective to Andy's point, that anything goes, depending on how you want to model it. Injuries can be up or down, depending on what you want to assume.
Potentially. Well, for one, I'm going to show you empirical evidence that they go up. So it could be the case that that's competing against it. But so to your point, though, intensive margin in the firm scaling, or
in the amount of product market shares they can capture after.
Yeah, so do I have in this slide? No, I don't. So the choice in this model with the functional form specifications that I'm using in this model, the scaling effect is going to drop out. So how the firm chooses to allocate resources across the two, across safety and across effort, does not depend on its labor or its demand. All of those are going to be captured by a scaling effect through labor, not through an adjustment in M.
So no matter how large L is, you get the same MS choice?
I want to be careful again.
So, yeah, I don't think that's true.
No, so any shock.
L would be smaller if you have smaller product market share.
Yeah, L would definitely be small if you have smaller product market shares. But if there's a shock to your demand or if there's a shock to your productivity, so if you have smaller shares through one of those channels, it's not going to affect the injury rate.
The injury rate?
Yeah, so it's not going to affect M, right? So the rate of worker injuries is not affected by demand shocks or by.
Yeah, the first organ, right?
In this slide, it's in the paper, but. Okay, so the other big assumption I'm going to make here is I'm going to assume that W is exogenous. I'm going to assume that workers don't get paid more for higher injury risks. This is a really strong assumption. The main reason I'm going to make it is because I don't have wages in the data, so I can't test anything related to it anyway. Although do in an appendix show that the predicted effects are consistent under a compensating wage differential. The argument here, I would say, in the defense of not picking up on wages, is that manufacturing wages over this time are very flat. So certainly there could be some change in the composition of those wages across workers of these industries, but in that I find that average injuries go up, we don't find that average wages are also going up to compensate for that. So the firm here is going to be choosing its labor, its injury rate, and its output per worker, where the latter two are coming through implicitly with its choice of resources across the two objectives.
I just still a bit confused with your answer to Mark's question.
Okay.
The model setup. So imports don't really show up in in the demand curve. You don't have a price index where the presence of imports has changed and the pricing seems like the firm's just a monopolist, right?
Right.
So I don't understand why is a monopoly model the right way of setting up a model with import competition? I mean, model the import competition directly, not just via this delta.
So I could. So I should make this clear. Thank you for bringing it up. So here, I mean, if I throw in some demand shifters, say price index, in front of this, if I instead consider that, the predictions for the change in injury rates aren't affected by that. So here I'm considering demand, I'm considering import competition only through the change in the shutdown rate there, and that it's affecting the likelihood of the firm being around in the future to pay those costs. It's not affecting the marginal product of output as a firm.
So can I maybe ask this question a different way? So if I think of a non-marginal version of this, you open the cutoff, the survival cutoff goes up, right? So you have to be a higher productivity, lower customer. So that's not delta, has nothing to do with delta. But in expectation, those guys should use something. They should be willing to allow more injuries. So those are the firms. You're going to tell us that the firms that are affected are the guys near the cutoff.
That's right.
Worst firms. That,
So you should upgrade your effort to avoid getting cut off by the new threshold.
exactly.
Yeah, so you're saying basically that I should have an endogenous shutdown review?
I don't like the idea of the argument being imports affect things in the model through exogenous death rate. I'm not sure I need all the convolution of the model. I think I can jump right to the data. I thought what was going to be going on is that the model is going to yield that fee is an important parameter in the endogenous choice of how much safety you provide to the product. Right? In other words, if I'm high fee, if I'm low fee, then I make different choices than if I'm high fee. Then something exogenous happens, right? The cutoff changes, it's precisely those firms that we're going to expect to see purchase. So it's just a little strange. The delta in his models is just typically to get some that steady state entry and exit. It isn't the thing that's, we don't think of these firm models as being over the delta varying over time.
Right.
That,
No, well, we're generally thinking about long run, right? We're generally thinking about comparing two long runs where I have some steady state churning amongst firms, but I don't think about
get
that.
some entry because you want something going on. So there's some normal movement in and out. And then it's the change in the cutoffs that we evaluate in response to trade rules.
Right,
But that's not what's going on.
no, it's not.
But
So if
yet you're going to tell us that it's a particular subset of firms that responds. So why is that going to be the case in your model? That the low fee firms are going to be the ones who...
because those are the firms that empirically experience the highest increase in.
Okay, that makes me just, like, that's kind of the answer that makes me least happy.
Really, a side show?
No,
So
no,
that-
No, it's but firm death in my paper comes from the fact that the cutoff changes,
Right.
right? Not because delta changes. So to be really clear, delta should be subscripted with a firm indicator, because you're going to have exogenously changing deltas that will vary across firms, and it will be a function of fee.
That's
Exogenous.
yes. That's
So,
right.
I
Yeah.
think-
So I don't have any subscripts here. But
Yeah, right. But I think that it would be more compelling if you have a delta changing the cutoff, the fee cutoffs, would then endogenously choose those low fee firms.
Or I put it another way, in Andy's model, it's deterministic who exits when the fees start, lower bound fee changes. What you're saying, the Poisson rate of death is changing, which is a completely stochastic process that doesn't really have to do with where you sit in the fee distribution.
Right. Yeah, no, I agree. So I guess I think of those cutoffs as more describing long-run relationships where firms are being pushed out. And your point, I guess, is that if that cutoff is rising above a particular firm's fee, that's the firm that's seeing a higher increase in delta.
If you told me delta increase for all firms, but your model gave you the behavior of firms vary your fee, I might find that interesting. You're about to tell me that you're going to have delta varying systematically with firm's fee. And that's going to be what we're doing. That's correct. That seems very common.
Does it?
Okay, that's not here.
Yeah, it's not written out correctly.
It's not in what way? So,
Well, yeah, because
Keep up.
okay, so yeah, we can. Okay, so as has been thoroughly pointed out, at this point everything is coming through in that delta. The import competition is affecting firms by reducing the expected cost of their entries. So import competition is going to be injected into the problem indirectly through that delta, based on evidence that import competition increases firm shutdown rates, and that the effects are greatest for the least productive firms. So in the paper, basically, I'm specifying that change in delta depends on firm is increasing in import competition, and that effect is heterogeneous across firms to where it's greatest for the least productive firms. So just to kind of wrap up the intuition of the model, I think even if you have kind of quibbles about the model, I think the intuition makes sense. Basically, following an increase in the shutdown rate, it makes it less likely that the firm is going to be around in the future to foot the remaining injury bill, and so the expected cost of injuries goes down. Investment in workplace safety is less valuable on the margin, and so firms shift resources away to that and increase their output per worker as a result, and this leads to an increase in worker injuries. So empirically, the model that we're going to identify says that injury rates are increasing in the level of import competition, and those effects are diminishing in plant productivity. So to test this hypothesis empirically, I need three things. I need a measure of injuries at firms, I need a way to identify the least productive firms, and I need a strategy for identifying changes in import competition. So I'm going to go through those one at a time. Yeah.
So if I think about the stuff I did in the heterogeneity response to import competition, I would have thought that one of the things that would be important for you would be basically within industry, not just productivity, which might affect the shutdown probability, but kind of what you're doing. So the high production worker, kind of generic firms who are making low-cost items and competing more intensively with China are going to, for many reasons, not necessarily model, but for many reasons, going to be more likely to not to face competition. And also, not just face death, but they're going to be adopting riskier techniques. If I have all non-production workers, I don't think my injury is going to be gone. And I'm driven with all this. So it might be that might be something that you could actually take advantage of.
Potentially. I don't have much data. I have production and non-production workers.
Right. So just the non-production worker share
Yeah.
should be, that should have higher rates and potentially higher changes. Okay.
Yeah, I can look at that. Okay, so first, the measure of injuries. How much time do I have? So the measure of injuries comes from this OSHA data initiative. I have limited data, but it's an interesting, it's a unique data set, and then I have injury and illness cases at the plant level for U.S. manufacturers, in addition to total employment, production, non-production workers, and total hours worked, and then I have the plant's industry at the SIC 4 level. This is an unbalanced panel that selects 50,000 plants each year out of the universe of all private manufacturing plants in the U.S. with at least 40 workers. So about 85% of all workers are included in this universe. So a couple things that come with that. One is I don't know anything about the very small plants, don't observe them in the data, and so I can't really speak to that. So the empirics are just going to be restricted to plants with at least 40 workers. As it turns out, that kind of buys us a little bit of credibility in one dimension that I'll point out in just a little bit. But it's an unbalanced panel, and so with that I can observe whether a plant drops out in a given year or whether a plant just isn't randomly sampled. So I can't get exit effects, unfortunately. The coverage is quite large, so it covers 53% of all workers in the U.S. in a given year, about 57% of plants. So it covers a good bit. of the total U.S. manufacturing industries. And the measure that I'm taking from that is what OSHA defines as the total case rate. It's the number of injuries and illnesses per 100 full-time workers in a year. So the likelihood, basically the likelihood in percentage points of you being injured on the job if you work for a full year. So
They have information on deaths.
they do. There's not many of them, thankfully. But,
Right, but that will be probably not subject to break.
yeah. So deaths, and that's what the Boone and Van Hours paper does. Is they use deaths. Basically, the story is that you can't underreport deaths. The one we're going to use, in part because we don't have many fatalities in the data, it's just too noisy, is looking at severe injuries. So I have both the number of injury and illness cases, and then I have those that require time away from work or restricted worker transfer. So under the premise that those severe injuries are less susceptible to misreporting, I'm going to run a robustness check with respect to reporting bias there and find results are less. So the second thing I need is a way to identify the least productive firms, because our model explains that those firms which are least productive and experience the biggest shocks in delta are the ones where injury rates go up the most. So we don't have any capital input or output data in the OSHA data set that we have, and so I'm going to make the assumption that size is a valid measure of plant productivity, consistent with Mellis and with our theory. It falls out that those least productive firms are smallest, but also run a robustness check with kind of the respect to the leading alternative explanation and show you some results there. And the third thing I need is a way to identify import competition. The main strategy that we use is following Otterdorn and Hansen, and we're going to look at how import shocks in the U.S., so within industry import shocks in the U.S., taking yearly product level data from the Comtrade database, mapping those products to industries that make the competing goods to get a measure of industry level imports, and I'm going to take log difference of those to get an approximation of the percentage change in Chinese imports in an industry in a given year. Over a period, year to year. The variation here is both across industries. Obviously, some industries have bigger shocks in imports than others, and across time. So the period I'm looking at was from 1996 to 2007. And so with industry fixed effects, I'm going to be looking at how the shock in 96 to 01, say, compared to 01 to 06. Obviously, there's a big endogeneity issue here that I'm going to use an instrumental variable strategy to control for, following the Otterdorn and Hansen paper. So the goal here is to identify supply-driven shocks in Chinese imports, but the concern is that this import growth measure is also driven by demand shocks. And so to control for that, I'm going to use an instrumental variable, which is the growth in Chinese exports in other OECD countries over the same time period. And so in the first stage, I'm regressing the growth in the US on the growth in other OECD countries, with the identifying assumption being that the common growth across the two is driven by Chinese supply shocks. Their accession to the WTO, productivity gains, and other supply side shocks. So the estimated equation that I take to the data is this. Looking at the log growth and injury rates of the plant over some interval of D years as a function of the import growth in the industry, so the change in the Chinese imports in the industry, and an interaction of that term with plant employment, along with fixed effects for industry and base year. And the identifying assumption here is that import competition increases the shutdown rates most at the smallest plants, justifying this heterogeneous specification here. So we would predict then that beta 1 is going to be positive, based on our theory that import competition is going to increase injuries at the smallest plants, and that beta 2 is going to be negative, that effect is heterogeneous and decreasing in plant size. It's a little unclear based on our theory exactly when these effects might happen. We're wanting to look at these short-run adjustments, but the existing literature doesn't really give us much guidance to go on exactly when those might be. So Bernard, Jens, and Schott are looking at 5-year spells, which is more or less conventional with people using the census of manufacturers. Pearson Schott using 10 years. One exception to that is Pearson Schott, who looked at the fall in employment following the tariff reductions granted China in 01, and they kind of give some idea of how these effects, at least with regards to employment, might evolve over time. So I threw these up here to kind of give you an idea, because our estimates are going to kind of follow a similar trend, which is that they kind of build 4 to 5 years out and maybe plateau out there. Yeah?
Could you just go back to the equation just so we understand?
Sure.
No, it's not an equation in differences, right? Because you have employment levels.
I'm sorry. So this is within plant. So it's a within plant change in the injury rate. I'm using base year employment as opposed to a change in employment, because that would be endogenous to the import shock. So I'm using plant employment as the base year as my proxy for productivity. specification
And
and
also, I just want to understand whether the plant fixed effect drops out here.
no.
That's-
What plant fixed effect? No, there's no plant fixed effect here, right?
I know, but
Oh.
the difference if you are not differencing it out, right? Because not everything is differenced here.
Right. So I'm looking at a trend in injury rates over time.
Why wouldn't you want to have a specification in levels with plant fixed effect, so everything to be able to control for unobservable presence?
In that way as opposed to indifferencing. In that way with fixed effects as opposed to indifferencing, right?
Yeah,
And
because I have a little bit hard time understanding your specific, because it's not everything is different, right?
right. Well, I mean, yeah. So everything but employment, which is kind of my proxy for firm productivity, for its exogenous productivity. The reason I'm doing this in differences is because there's a structural decline in U.S. injury rates over this period. So injury rates, those injuries per 100 workers are going from maybe 9.5 injuries in 1996 down to about 5.5 injuries in 2007, and that change is heterogeneous across industries. So as production technology is changing and safety technology is changing, injuries are becoming more costly. For all these other reasons, unrelated to Chinese import competition, there's this downward trend in injury rates. And so in differences, I can allow for that trend in injury rates to be heterogeneous across industries.
I guess I'm going to object to that phrase, unrelated to Chinese import competition. Chinese import competition is inducing firms to move upmarket and use, hire more educated workers who are matching with computers rather than blades. And I would be surprised to see within plant that the industry rates decline precisely because of Chinese import competition.
Right.
So here it's going to be that there's going to be something. So if that's the baseline, then what you're doing is you're doing some deviation.
That's right. So I'm looking, this is capturing this long run 1996 to 2007 trend in an injury, in injury rates in an industry, which might potentially be affected by changes in the trade environment. I'm looking at small shots within that longer time horizon. So with the data, I just can't get out exactly what those longer term effects are. I'm going to estimate this for both shorter and longer intervals of time. There's a trade-off there. When I'm looking at shorter intervals, there's a greater sample size and there's greater representation of these marginal firms that are pushed out by import competition in the long run. But the trade-off is that the instrumental variables are weaker, and in fact, they fail a weak instrument test for the 1 year difference. The reason, right, is that if the growth in Chinese exports in the U.S. over a given year isn't perfectly correlated, isn't perfectly timed well with the growth in these other countries, then it's not going to be picked up on by the instrumental variable, right? So comparing 5-year growth to 5-year growth is much more forgiving of kind of smaller delays across the markets. So there's some trade-off there. Over long runs, we're excluding more of those short-run losers, but losing some intertemporal variation in the industry shocks, right? More of it is being soaked up by that 11-year fixed effect as opposed to the shock within it.
And you're also getting rid of, you're only keeping survivors.
That's right. Yeah, so
So the initial income and the initial employment, probability of death at the end that you have is got to be probability of death in year 6 or beyond. These guys survive for 5, so don't have to worry about that. That's what you're actually selecting our guys.
well, I mean, worry about it in the sense that is there an extensive margin here? Absolutely. I mean, the empirics are just going to be focused on within surviving plants. So with this, I'm only able to identify what's going on within the survivors. I can't pick up on the effects of plants exiting. Maybe we can talk later if you have an idea how to do this data. But yeah, so this is just within surviving plants. Now, I guess looking at a 5-year change, it doesn't necessarily have to be the case that the plants knew they were going to survive for the full 5 years, right? Okay, so I've grayed out the 1 year because they failed the first stage weak instruments test, but all the other results are significant, at least one at the 10% level, the other at the 5 or 1% level. And so what we find is that import competition increases injury rates at the smallest plants and that the effects are diminishing in plant size. So this is looking at the log growth in Chinese supply in an industry against the log growth in injury rates within surviving plants. And so down here, this gives the elasticities across the distribution of plant size. Keep in mind that these are heterogeneous across plants. So I'll point to 5 years just to be kind of consistent with the literature here. Basically, we see that at 5 years, there's about a 10% pass-through in terms of the log growth in Chinese imports on the log growth in injuries at the smallest plants. This is about the 10 percentile of our sample.
Is that initially small plant? So at the
Yes.
beginning, you think you could control for the change in employment? Because things could have changed in that direction too. I mean, part competition is going to affect the size.
It will. So it's not going to directly affect the outcome measure because it's injuries per worker. But could it be going on? Yeah, I mean, that's why we're using base here is because it's presumably endogenous, but it's not going to directly affect the outcome variable. The firm downsizing or growing larger isn't going to directly affect that because it's a relative measure of injury rates.
Can I ask my question about that?
Please.
So if there were strict truncation at 40, then any plant that you observed initially at 40 has to have positive growth. Because otherwise it's not the sample later on. So there's kind of this inverse relationship between your initial size and your average growth subsequently, and that's going to overturn, even if these are the right plants, that's going to all go the wrong way. It's going to say the guys who are growing more quickly, right, are increasing their injuries. Because if you start at 40, the odds that you're in the sample are almost zero if you have any decline.
Right. So two comments there. That's a good point. So one is it's targeted towards plants. The sample is targeted towards plants with 40 workers per the BLS estimates. The employment that I have in my data is from the survey that takes place later on that year. So it could be that some disparity. So there's about let's see, about 10% of plants. I suppose it's the first decile. About 10% of plants report employment less than 40. About 3% or less than 30 workers. So this isn't a strict cutoff here. So for the reason that might get a little bit hazy, maybe it's under reporting or maybe there's some sort of reporting error there, we could chop this off and use higher cutoffs. And so if I cut the sample at 100 workers, I see pretty similar point estimates here and the same sort of heterogeneity. So that's a good point. It's one that I should mention in the paper. But if I chop out these plants, I still see the same effect.
So one thing you should check is you should take the initial employment, subsequent growth of employment, and just see whether you're getting this negative relationship. This would be, because the talk is about the guys at 40 are likely to die smaller. They have to do something bad in their workers. But if they're actually, because of selection, doing well, you're getting this effect that so,
Yeah, no, that's a good idea. Okay. Thank you. All right, so this graph shows the marginal effects across the distribution of plants that we have in the sample. The solid line giving you the elasticity and then the dotted spanning the confidence interval, and then I proved the density up there of the plants in the sample to give you an idea of exactly where most of these lie. So the effects are positive and significant for plants up to about 250 workers, and weakly positive all the way up to kind of really the very, very largest plants in the sample, where injury rates might potentially fall. So real quick, I guess to kind of close it out here. I run a back of the envelope exercise to figure out exactly what the magnitudes of these effects are, comparing the growth in injury rates given the realized trade environment versus the counterfactual where there was no supply-driven growth in Chinese imports, and find that Chinese import growth accounted for 7% of all U.S. Manufacturing worker injuries, which amounts to about an extra 0.5 injuries per 100 workers, or those numbers I showed you earlier. But again, these are heterogeneous across plants. So I guess if I could have you take away one image from this presentation, it would probably be this one, which is why I put it last when you're fatigued. So the orange bars here show the injury rates under the predicted by the model under the realized trade environment, and the light blue bars are under the environment where there's no growth in Chinese imports, supply-driven growth in Chinese imports. Two takeaways here. One, obviously, is that injury rates are higher for the smaller plants, and the second being that the difference in injury rates is positive and greatest at the smallest plants. So injury rates were much higher at the smallest plants as a result of Chinese import competition relative to the very largest plants, where these effects up here are statistically insignificant. I also used the Pearson shot measure out of concern for exogeneity of our measure of import competition, and find that in industries where the permanent tariff reductions were the greatest when China joined the WTO, injury rates go up by the largest amount, and the effect is greatest at the smallest plants. Reporting bias, as I kind of alluded to earlier in response to Andy's comment, we take just the severe rate of injuries and find that the effects hold for those as well. So for those injuries that are presumably less susceptible to underreporting, you still see the same effects. And lastly, An alternative explanation is that size might instead be a measure of productivity, so it might be that, instead of a measure of productivity, that size might explain productivity differences, that size might explain specialization differences across plants. So Holmes and Stevens basically say the smallest guys are the most specialized. We run a bunch of robustness checks to kind of throw that out and show that basically the heterogeneity in our results isn't driven by specialized plants. So to conclude, in the paper we show that import competition increased injury rates at the smallest plants and that this is an important channel for welfare effects. The paper contributes kind of this broad literature on how labor standards are affected by trade, contributing evidence both in a developed country in the US and also looking at these shorter run effects as opposed to kind of long run income effects. And the results suggest that in accounting for welfare changes of trade liberalizations, we should account for this dimension as well. And it might be the case that OSHA would be enhancing welfare if they were to target plants with import competition, but that's a little bit outside of our model because we can't pick up